Hey everybody, today I'm going over the treatment plan that I put together for the individual I'm working with, Aileen Wuornos. Using the Matters format, Aileen has been through a lot in her life: PTSD, bipolar personality disorder, years of trauma, abandonment, sexual issues, unstable relationships, the whole 9 yards. Everything we do with her is inside this secure facility. Before I jump into matters, I want to explain a little bit about what she's dealing with. The individual's trauma started extremely young. She was sexually assaulted at 8. Her father didn't believe her. She was physically abused. She ended up giving up her child for adoption as a teenager. She started doing sex work at 13 just to survive. She talked about times where she sat on the edge of an overpass with a gun, basically telling God if he didn't give her something to live for, then she was done. That tells me she struggled with hopelessness, but still there was still a little piece of her that wanted something better. A lot of her symptoms line up with PTSD and BPD, post-traumatic stress disorder, and and borderline personality disorder. Things like shaking when she talks about her trauma, being easily startled, mistrusting people, getting angry fast, and having a hard time calming down. She has trouble with abandonment, rejection, and she reacts based on fear, not logic. All of this makes sense when you hear what she's lived through. Now going into the matters part. Medically, she does not sleep right and her stress levels are constantly up. With employment supports, I was checking the time and it made me mess up. With employment and support, she really doesn't have a stable work background or many positive supports. With substance use, it has been documented that Aileen was a heavy drinker. In addition to alcohol, Aileen occasionally used crack cocaine. However, it was not as prevalent in her life as alcohol. Legally, she's incarcerated. All treatment happens here. Socially, she's had unhealthy relationships her whole life and doesn't trust easily. Aileen struggles with intense emotion, fear of being left, and trauma symptoms. The goals we made together are simple and realistic. Goal 1 is helping her manage her emotions in healthier ways. Goal 2 is improving how she communicates and handles her relationship. Goal 3 is understanding what triggers her alcohol use and finding healthier ways to cope. Goal 4 is trauma stabilization, grounding, learning her patterns, and helping her stay present without going into deep processing. And Goal 5 is helping her build a daily routine so she can function better overall. Her objectives are all things she can actually do. She's going to identify 3 emotional triggers within 30 days and practice basic coping skills like grounding, breathing, or just taking a moment to herself. She'll talk about unhealthy relationship patterns and show at least one appropriate interaction each week. She'll identify 3 triggers for drinking and complete relapse prevention plan within 60 days. She'll name 3 trauma symptoms she notices in herself and practice grounding skills in most sessions. And she'll make a simple self-care checklist and stick to it at least 5 days a week. Interventions are exactly what we can do in this setting. I will meet with her weekly and work on coping, emotional awareness, and problem solving. She attends weekly group on communication. She does substance use education and to understand how alcohol ties into her reactions. We will do grounding work for trauma and she can stay present and feel safe. I will also help her build a routine she can follow and use motivational interviewing to keep her engaged and thinking about her choices. As far as the general checklist, this plan is completely individualized to her trauma, her needs, her abilities, her environment. It is written in clear, non-judgmental language she can understand. The goals and objectives are realistic for where she is right now. We will pull from her strengths, like the fact that she can express herself when she feels safe. Family involvement doesn't apply, so that's noted. Overall, The plan meets matters expectations and supports steady, realistic progress. Thank you. 5 minutes. I was trying to get it into 3 minutes. I thought that was going to take forever. Thanks.